As Imtiaz brought up, a massive polio vaccination campaign is underway in Gaza as aid workers try to prevent the disease from spreading among children. Nearly 200,000 kids have been vaccinated in the first few days, and this comes after a 10-month-old baby was left partially paralyzed after contracting polio in the war-torn region. That was Gaza's first confirmed case in 25 years. Joining me now from Gaza is Dr. Naina Bhalla. She is a medical team leader with Doctors Without Borders. Thank you so much for talking to us. Listen, a mass vaccination initiative is challenging under the best circumstances. Can you sort of give us a sense of how you all are even pulling this off? I have to say I'm impressed with the number of children who have already received this vaccine, but how are you doing it?
Yeah, I'm also very happy and very impressed with the numbers that we've seen thus far. The goal is 640,000. We have about less than 10 days left. We'll move into our zone in Han Yunis in the south tomorrow. But it is an undertaking. We still don't have all of the details of exactly how everything is going to happen or how we're going to start tomorrow. It is a great undertaking spearheaded by the WHO, UNICEF, the Ministry of Health, and 700 medical points that are identified. Pretty much all of the humanitarian NGOs are participating in this at all health centers, shelters, hospitals, medical points. And I think another factor that is a big part of this is that before the conflict, the vaccination rate in Palestine and Gaza was over 99%. So this is a population who are, even though they are skeptical, as I don't blame them to be skeptical of this vaccine coming in and being encouraged to take it. They understand the risks of this. They are all just trying to live and survive. And they understand what would happen if they do not vaccinate their children. And they believe in vaccines. They had a vaccination rate that was higher than some developed countries before the conflict.
That's really interesting because I just did like a sort of a quick sort of Google search about the vaccine, and I saw, the CDC, on the CDC page, it says it recommends children get 4 doses of the vaccine to ensure sort of complete protection against polio disease. And I thought there's no way these kids are going to have an opportunity to get 4 doses, but it sounds like at least many children would have been vaccinated at some point sort of early on. What are the limitations that are in place for aid workers and doctors trying to pull this off?
So one thing to remember is that, as I said, the vaccination rate before the war was over 99%. The war is going on now almost a year, and EPI vaccinations, the normal routine vaccinations that all children would get, have been almost non-existent for the past year, although they have really tried as much as possible. So most of these children haven't received any polio vaccine if they've been born after October 7th. And most of the help that we will be providing, there are Ministry of Health vaccination teams that will be coming to each site. We are responsible to help provide organizational tools, logistical support, and also some of our staff will be participating, but most of the staff that will be participating is Ministry of Health staff.
As you know, even though we have a pause in the fighting to allow this to get done, we're still talking about a conflict zone. We've seen aid workers come under attack who have been very clearly marked as aid workers. There must be a concern that staff from your organization and other NGOs are incredibly vulnerable. Are you getting the assistance or support that you need from the IDF?
We are hopeful that the IDF will respect the humanitarian pauses that are outlined for each zone. This is not what we hoped for. We were hoping for an immediate ceasefire or longer pauses. These are just 9 hours. We get just 9 hours every day, and there's no guarantee that they will be respected. We are hoping that will be able to reach all of these children. But again, there has been a pause, a humanitarian pause for 9 hours in the central zone. In the zone that we are in the southern zone, there has been continued fighting for these past days. So the humanitarian pauses are per zone. It's not in all of Gaza. It is not the whole day. So it doesn't mean that there won't be fighting at night, which could affect the ability of the health workers to come and vaccinate children. It can affect the ability for families to bring their children to get vaccinated. And there's no guarantee that the pause will be respected.
Tell me about the children that you are seeing, because I'm sure that, while you're administering this polio vaccine as a doctor, there must be all these other ways that you wish you could intervene when you see these children. What are you seeing?
So we have multiple activities. We are supporting a Ministry of Health hospital at Nasser Hospital, running their orthopedic and burn unit. There's a lot of children in our burn unit, some with domestic burns, but many of them also with explosive injuries related to burns. We are seeing children in our primary healthcare center. So polio is one of the things that we're trying to deal with, but it is one of several things that we're trying to deal with here. We're dealing with a high rate of contagious and communicable diseases that are related to the living conditions and the lack of hygiene items that are allowed to come into Gaza, including 50% of skin infections amongst children and adults that are being reported not only by all of the humanitarian organizations, but also by the WHO. We are seeing children that are traumatized. The other day in our hospital, there was a child who was sitting in the garden with his father, and his father went to get water, and the child just started screaming, and he was unconsolable. And this is a child that has lost his mother, he has lost his 3 siblings. So anytime that the parent just walks away, the children are traumatized.
Yeah, indeed. There are scars that you can see and scars that you can't see, that will last a lifetime. Dr. Naina Bhalla, thank you so much. You all with Doctors Without Borders do incredible work. You leave behind your family, your practices, your safety to help around the world. And I'm going to personally say thank you, and thanks for giving us a little bit of time.
Thank you. Have a good day. Thanks for having me.